So, ladies and gentlemen, we welcome everyone to this webinar on self-care of elderly during COVID times. This is the second webinar in our series. We have a very, very distinguished panel. We have Dr. Vinod Paul, who's member Health and Nutrition. We have Dr. Nirja Batla, the professor and head of All India Institute of Medical Sciences. We have Dr. Tanuja Nesari, the director of the All India Institute of Ayurveda. And we have Ms. Rujuta Devakar, a very, very distinguished nutritionist from Mumbai, and who has also given us her expert advice in an earlier show. We have greatly benefited from her inputs. So, ladies and gentlemen, as we are all aware, the coronavirus or COVID-19 pandemic has brought about unprecedented fear and total uncertainty. And these are very challenging times for all of us, and even more so for the elderly. They are at higher risk of infection from COVID-19, and therefore we need to take special care of them. An age-wise comparative study shows that the elderly group has faster progression of illness and increased fatalities. Along with this, elderly are vulnerable to mental health issues like depression and anxiety, which gets aggravated in COVID times. To curb the comorbidities and improve mental health, it has been suggested by many to do easy, simple exercises, do yoga, basic breathing, etc. But I would like the great expertise and inputs of our very distinguished panel. And I would first request Dr. Paul to provide us insights to our viewers on why do we need continuous care of elderly and why does it become so important during COVID-19?
Thank you very much, Amitabh ji. Very warm welcome to all those who are hearing and seeing this webinar, and my deep gratitude to the eminent panelists, the very best in the country. We are passing through difficult times in the COVID pandemic. We as a nation have demonstrated great resolve as well as restraint in tackling this pandemic in a very effective way. We have limited the spread of the disease. We have limited the number of deaths in the country, but we are now also mindful of the fact that when we are loosening the provisions of the lockdown, we are moving toward more normal life. The challenges have become even more to be taken care of in a more effective manner, because the virus is around us. And when we move toward more normal life, we have to be very mindful of the fact that our elderly are very vulnerable. Like all citizens are vulnerable, but elderly are particularly vulnerable because they have a higher likelihood of a serious disease and also, sadly, higher likelihood of difficult complications, fatal complications that may arise. And therefore, as a strategy to reduce the adverse impact of this pandemic, it is so very important that we look after our elderly in the most protective way, most respectful way, and to the best possible extent in the scientific way, connected and contextualized to our cultural aspects and our culture, how we look after our families, and with focus on elderly. So this is the context in which we come to you, and we would like to hear the opinion of our esteemed panelists. We want a very important focus on the care and the concerns of the elderly women, and that would be a special focus. There are special needs for women who are of a particular age. And with these words, pleasure to be here. And we would look forward to listening to our esteemed panelists, listening to their messages. And hopefully this will be a dialogue which will help self-care by people who are listening to us, and also enable families to look after our elderly, our respected parents, our respected elder brothers and sisters, to be looked after well by the families in our homes and communities. Over to you, sir.
So, Dr. Sahab, we have a very, very distinguished professor and head from the All India Institute of Medical Sciences, Dr. Neerja Batla. I would like you to guide us on what are the do's and don'ts to be kept in mind for reducing the transmission of the virus amongst the aged population. Please unmute. Unmute. Tell them to unmute.
Thank you for the invitation to be here on this distinguished panel today. And we've all been hearing so much in recent times. I think we are almost all of us just glued to the television, to their WhatsApp messages, hearing so many things. But also true that sometimes these things can be confusing, and sometimes there is always the danger of hearing some fake news and getting worried about it. But I think broadly the do's and don'ts are reasonably clear now, and they have evolved out of the experience that has been shared by various people in various countries on what works and what doesn't work. And if I were to try and synthesize it, I would say the first most important thing for the elderly is to stay at home. And that is what has been repeatedly iterated in our lockdown messages. People who are aged over 65 should stay at home, and even within the home, they should avoid meeting visitors. Now, as the lockdown eases, there may be some feeling that there should be social interaction because people are tired of being cooped up. This is to be still avoided. And if at all meeting is essential, that maintaining the distance of 1 to 2 meters is vital, and keeping the masks on while meeting any visitors is absolutely essential. And washing of hands and face at regular intervals with soap and water, and doing it for a minimum of 20 to 30 seconds, is the single most important and effective thing. And cleaning the frequently touched surfaces with disinfectant regularly. So that includes things like phones, remotes, tables, doorknobs, light switches, countertops, handles, desks, keyboards, toilets, taps, sinks. Every day, all these surfaces to be cleaned with disinfectant regularly. Now, everybody knows that a proper nutrition is vital. You are what you eat. I'm not going to dwell on that because we have a real expert who will tell us that. But that's part of the do's, is to ensure proper nutrition, exercise, maybe meditation, and to identify really what makes you feel good. I think it's a composite: physical, mental, emotional health all go hand in hand. So for one person, it may be listening to music. For another, it might be doing a little gardening, even indoors or on the terrace. So we need to find out what makes us happy, to realize that this is a temporary phase. It's not forever. Let me try and feel better while it is there.
Thank
Medicines regularly and making sure you have a supply for at least 30 days. Of course, now we're getting out of the lockdown phase, but it may be stressful to think, oh, what's going to happen if my medicines run out? So talk to your family members, call them up if they're not with you, stay engaged with people, postpone elective surgeries, monitor your health. These are the most important things. And I think most of the don'ts are converse of that, except don't try to self-meditate, don't go to hospitals unnecessarily, don't plan elective surgeries that can be postponed, and don't go close to anyone who's got a cough, cold, fever, etc.
Thank you, doctor. Thank you so much for this inputs. Very valuable inputs you've given us. We have a lot of listeners online. We're getting a lot of queries, and I'll request everybody who's online to keep posting their queries. We'll raise your questions to our experts. we have the director of the All India Institute of Ayurveda, Dr. Tanuja. She's a very, very distinguished expert. Dr. Tanuja, can you give us some insights on how we can use Ayurveda? How can we invoke this India's ancient wisdom for our elderly to fight against COVID?
Okay, thank you, sir. Honorable Sri Amitabh Kanji, who is a creator of God's own country at Kerala, and Dr. Vinod Paul, for giving us this wonderful opportunity for Ayurveda. And in Ayurveda, what I would like to mention here, that amongst 8 branches of Ayurveda, Ashtanga Ayurveda, one branch is Jara, and that especially mentions about how to take care of the elderly and how do we really attain a graceful aging. And in this critical time of COVID, where more than 75 cases of death are in between 60 to 80, so we can really take care and use this ancient wisdom judiciously. And as we understand that why the elderly are more vulnerable to this corona COVID, because of fewer T cells and fewer B cells, and they really have a strong, as compared to younger, they have a less immune memory and a weak immune system, and they do not sustain to do cytokine storm. And if we really want to survive through this cytokine storm, it is the Ayurveda and Ayurvedic rejuvenation therapy. We call it as a Rasayan, antioxidant, where in elderly especially the free radicals are more, and we need something which has a free radical scavenging activity. In elderly, telomerase, aging process, telomerase length is shortened. All are rejuvenating herbs. They increase the telomerase and they reduce the inflammation. So the rasayanas in Ayurveda, antioxidant herbs are really useful to have, because of its antioxidant immunomodulatory anti-inflammatory action. And if we consider aging, especially in Ayurveda, it is because of more Vata predominant condition, more Dhatu Kshaya, that is a tissue depletion. Agni is low because your metabolism has gone down and overall immunity is weakened. So because with the help of our Rasayana management, herbal diet, lifestyle, and code of conduct, we can have immunomodulation, we can attain longevity, which really helps in developing mental competency, and also which is really helpful in attaining managing comorbid condition. What I would like to highlight here, all these simple herbs like amla, giloy, and haldi will not only are immunomodulatory, but it is said in Ayurveda that Meheshu Nishamalku, the same immunomodulatory herb is also useful in managing diabetes and comorbid conditions. So that's the beauty of Ayurveda. And more important in this testing time is the code of conduct, because as Madam Batla said, that what is important is to make the life of the elderly more comfortable and happy. So behavioral code of conduct in Jara and in Ayurveda really helps to take care of elderly with the lifestyle, with the diet, with the passion, compassion, and the attitude which makes them comfortable and healthy and happy. So we really recommend to have, maybe simple example I can say, that in this social distancing, we say physical distancing, but socially connect. So we really take care of the elderly people, where we give them more time, more attention, more love, compassion, and listen to their need and make them more comfortable with the behavioral code of conduct. With the lifestyle, which is more important, that more thrust is given on the sleep, because we recommend to all elderly the sleep between 10 p.m. to 6 p.m., minimum 6 to 8 hours sleep, and their diet should also be between 8 a.m. to 8 p.m. before like the sunset. During the sunset, they should not have the meal dinner late night, and in between the breakfast and the dinner. What more important is the diet should be light, easily digestible, along with ghee, fruit, raisins, amla, and fruits fresh. Fresh is the
Okay.
yes, sir. And
Okay. Thank you. Thank you so much. Thank you for those insights.
yes, sir.
We have with us uh, India's most distinguished nutritionist. She's a real expert on this. So, Rajita Devaka, and I would turn to her because Rajita, one of the challenges is that elderly do not eat well. They have a lack of appetite. There are problems of digestion. Please tell us how to ensure that their nutritional needs can be well taken care of.
Well, there's plenty. First of all, thank you very much, Amitabh ji and Dr. Paul, for having me over once again on the webinar. It's a real pleasure and honor to be amongst such a distinguished panel. Like we discussed the last time, that it's important that we eat good food, that there is consumption of millets like ragi or the red finger millet, because that's good for bone mineral density. It is easy to digest. Then, of course, there is ghee. There are dry fruits that one can powder and have in case chewing on them is difficult. And then a simple meal like dal rice or a khichdi really more than provides with the good ratio of essential to non-essential amino acids. But today I would also like to say that you know exercising is also critical for the elderly, especially during these times. And one of the things that lockdown has done is that it has brought about a big change in their routine. A lot of our senior citizens would go out for a walk, and that is something that they are unable to do during this time. So there is something called as 4 S's of exercise: stamina, stretching, stability, and strength. And invariably, what happens is that the elderly do tend to focus on stamina by going out for a walk or a stair and stuff, but they don't quite look after their stability, their stretching, and their strength. And I feel lockdown is a wonderful opportunity to focus on these overlooked aspects of exercise. So, a few simple exercises at home will really help focus on the stretching, stability, and strength, and more importantly, allow for improved digestion, allow for improved, even excretion, not have issues of constipation and stuff. And now that we know that, even low vitamin D is influencing how severely you're affected by the disease. Exercise is one of those things which allows for better assimilation of micronutrients like vitamin B12 and vitamin D, which will then help you have a better response to, it improves your immune response. Exercise is really critical. In fact, I even released a video for what senior citizens can do at home during lockdown in terms of their exercise. And I'm really happy to share with all the viewers that Niti Aayog has kindly agreed to even release the infographic later. So that will be quite useful, because a lot of times we confuse exercise with exertion. Exercise need not exhaust you. It just needs to be adequate so that you have adequate blood circulation. It even leads to regulation of BP and diabetes, allows you to sleep better, and more importantly, helps you secrete feel good hormones in your brain. And I think that is something that each one of us needs right now, a dose of positivity, and nothing like a bout of exercise to really get that, that boost of our immune function and also a good dose of positivity. So 30 minutes is something that I would think is critical. And maybe if you can't make 30 minutes together, split it into 3 times, 10 minutes each, 10 minutes in the morning, 10 minutes in the afternoon, and 10 minutes in the evening. But get that dose of exercise. And for all those of you who are looking after the elderly, I would strongly recommend that you encourage them to stay active. Don't treat them like they're sick, because they're not. They just need more motivation to, I think, stay active. Maybe even help them connect with a few online classes where they can do their yoga or learn a few stretches and the likes. I think that is something that I would recommend. And I totally second what Dr. Trivedi or even Dr. Batla said, that, fresh food, ghee, simple khana, I think that's really the way to go. It's not the smoothie, it's the khichdi for these times.
But ghee in limited quantity, 1 spoon?
Well, I would think at least a teaspoon for breakfast, lunch, and dinner. And, we have really received this oral wisdom of how much ghee in every food that we cook. So based on what is it that we are eating, we need to add proportional amount of ghee. So to give you an example, if you had a millet like nachni, you would probably need to add a little more ghee as compared to what you would add on dal and rice. So enough ghee to enhance the flavor of food, but not that much ghee that it will mask all the flavor of food.
Okay. Vijita, one more request I had. If your
sir.
video which you have, we'll be very happy to put it on Niti Ayog's website as well.
Oh,
And then
thank
we can,
you, sir.
and we are running a separate program for Dada Dadi and Nana Nani, which we'll share with all the district collectors in the district. So it'll help us to, spread this message far and wide.
That's
I would
wonderful.
again turn to Dr. Nirja because, Dr. Saab, one of the challenges is that many of the elderlies are actually suffering from ailments, and many of them are suffering from ailments relating to respiratory disorders. Is there any special care needed by these patients in the present COVID times relating to this?
I think that is really important because we have seen that respiratory morbidities are the main reason why people are having severe disease, as well as, when we have the people who are not making it, that's a serious reason. So if you already have a respiratory problem, you definitely need to take care of it, but everyone needs to be a little cautious about it. So one thing is that the home atmosphere should be very comfortable and dust-free. And as summer comes, sometimes we see a lot of dust coming in. And in fact, our old-style coolers are quite useful to help to settle down the dust and keep the humidity level going as well. Even for air conditioners now, the guidelines have been put out as to how the air conditioning has to be used, and temperatures should not be made too low. The minimum you should go is 24, not lower than that, for everyone, not just the elderly, but for everyone. And the elderly can also see, because some people say it doesn't suit me and I don't want it. So follow whatever makes you feel good. But when you use an AC, you must remember that no longer is recommended that the door should be tightly closed. You should have a window or a door partly ajar to allow the circulation of fresh air as well. A thorough cleaning of the house is very much required. Patients who are asthmatic should not be doing this themselves. They should get it done by an assistant. I already mentioned about the systematic cleaning and disinfection of all the surfaces, but also we should see about the spray products that are there, that they are put onto the cloth or the towel and not directly on the surfaces, and that will be helpful, especially for patients who are already asthmatic. And we can also make sure that they are, I think they must keep their, they know how to use their inhalers properly so that they are able to be a little self-sufficient. And I think it's very helpful also to keep an emergency helpline system ready, that you know who are the people you have to contact, your emergency lists of doctors, and maybe on the dialing, if you have a way to make it a quick dial, you can do that, or keep the numbers with you in a separate place, so that if you have any significant symptoms, you can immediately turn to your doctor and talk to them that you are having some difficulty in breathing or shortness of breath or chest pain or pressure, and you need to then go and see someone. But do not go to the hospital till you have first talked to your doctor and checked out that you can take some medicine at home as per their advice, or do they really need you to come and show what you are having? The most serious trouble really is if you have trouble in breathing, persistent pain or pressure in the chest, some new feelings of confusion, you have an inability to awake or to stay awake, the lips are looking blue, the face is looking blue. These are really something suggestive of severe problem, and you must not take that lightly, and you must immediately have somebody to help you and take you, and whoever is looking after has to make sure about that.
Thank you, Doctor. Thank you so much. Dr. Paul, I wanted to turn to you because you are also chairing the Empowered Group #1, which is looking at the whole country and how the COVID is unfolding in this country. One view is that we should allow young people to go through a process of herd immunity and take care only of people of above 65 with comorbidity. What's your view on this? Should we push for herd immunity?
Firstly, the second part of what you said is correct, that we look after our elderly. We protect them for getting infections, and these infections would come from other people and very often from young people. So that part is valid. We both agree on this, and it has been very emphatically brought out by all our eminent panelists. So we have to protect our elderly because of the excess risks that they experience, and particularly when there are comorbidities, which of course is often the case. Now the issue is one approach potentially in infectious diseases is that when there is a certain amount of herd immunity, which generally comes up when around 2/3 of the population is already exposed to a particular agent, then the infection cannot go further because a lot of people already have protective antibodies, and therefore the virus finds it very difficult to reach the unprotected individual. A herd immunity has a cost, sir. Herd immunity means 65% of India's population has to get infected. Now, this doesn't come free. This comes along with a certain amount of mortality, and even at the bare minimum, even something like 1% or 0.5%, if you put those numbers, they are staggering numbers. They are very worrying numbers, and I don't even want to go to those numbers. So this strategy, though scientifically, pans out in real life, in nature, and may have happened in the same way in the 1918 flu pandemic, but this cannot be our choice. One particular nation went on this path and said, okay, let it come and we'll face it up. And then there was too much of a cost in terms of morbidity as well as deaths that they had to retract. And that's actually a bad example. So we must go for on two fronts. One, we continue to protect ourselves to the extent possible. We take all precautions. We particularly look after, again, the most vulnerable, those with morbidities and those of a particular age, and so on. At the same time, we do know that increasingly people would get exposed over a period of time. Let that happen slowly. If it happens in an uncontrolled way, we may have a load on our health system which may not be bearable by the health system. We cannot be leaving it to the nature and the decisions and the control of the virus. What we should therefore do is to protect our elderly, protect ourselves to the extent possible, keep the pandemic under such a control level that the morbidities and the sickness volume that comes up is eminently manageable by the health system across the country. And we cannot allow this pandemic to go out of control above that range. Therefore, herd immunity is something that would happen to all of us, but we cannot have a free run for the virus to first ensure that we all get infected, we have herd immunity, and then it comes to a knot. That is not a good scenario to work with. That's an unpredictable scenario and a very costly scenario.
Yeah. Dr. Tanuja, I have two questions for you. There are a lot of questions coming, but I wanted to ask you
Yeah.
from the people of India. There are two questions.
Yes,
One
sir.
is that there is a lot of element of fear of corona, fear of the pandemic,
Yes, sir.
and there is a issue of stigmatization.
Yes.
Everybody's. How do we handle the issue of fear? Because we need to get out of this element of fear. Because we have to normalize, otherwise economic activity will suffer. How do we
Yes.
get out of the element of fear? And also this challenge of stigma. What is your advice on stigmatization?
Yes, sir. It's a really very relevant and the valid point. And now also, especially when there is a more and more positive cases coming up, like per day 5,000, and the number is increasing. So people are worried about saying that the corona positive. But in India, what we can see is the percentage of the mortality is compared to other diseases, it is very, very low. And what important is that because in India we have a innate immunity, and the Ayurveda is imbibed in our culture, our wisdom, that the heritage and our lifestyle, our diet, our rituals, whatever we live is to the Ayurveda, where we improve and we take care and protect ourselves from the immune boosting measures. So to strengthening our immunity, that not only strengthens our immune system but also supports the mental strength, that boosts up the mental strength, that is more important. And for this fear and phobia, like I give the example of All India Institute of Ayurveda. Right from day one we started immune boosting kashaya, what Ministry of Ayush also had suggested about tulsi, giloy, haldi, Mulethi, Shunthi, and Manuka. So with this kashai, which is immune booster and also antiviral also, and with simple spices we have started taking. And in Delhi, 80,000 police personnel, and to everyone we are given this kadha and giloy and aula simple measures. So that gives us the protection and the feeling of having the mental strength. And also the rasayan not only has an effect on improving sharir bal, but it also strengthens the manobal, mental strength. And now I can say it with confidence and with a proud feeling that amongst all red zones we are green with the immune boosting measures. So if everyone we promote this awareness about using all immunoboosters, which is from their ancient wisdom. If we really start taking everyone India, like Aula, Gilo, and many other, which are time-tested, evidence-based, so that will really help in improving, protecting the immune system, and that fear will go. And stigmatizing, I would definitely say that it is like the other flus. So there is no, but because even those are positive, the number of cured cases are more than the mortality. So there is a no need of stigma, no need of a fear. We are receiving more number of cured cases than the mortality rate. So if we really start using Ayurveda judiciously, immune boosting measure with good lifestyle, good diet, I think this is the time we can say there is a blessing in disguise that has really helped us touching the root of our nature. So if we start using the natural, simple, and the healthy way, I think this corona has helped us in learning ourselves to go back to the nature. So this is how I think we have to come out with the fear. And lastly, what I would like to share, sir, here about using ghee and milk. Ayurveda says that Nityam Grutak Shirabhyaso Rasayananam Sreshtam. So if we use ghee, 1 teaspoon and 1 cup of milk every day, that really improves our physical and mental strength also, and especially in elderly. And this ashwagandha and mandukparni and brahmi, especially in this vulnerable group, Ayurveda has advocated to use brahmi and ashwagandha to take care of the mental health and to come out with the anxiety and depression and insomnia. Thank you.
Thank you. We have a lot of questions coming, and I would request all our viewers across channels, Facebook, across Twitter, across all our channels, YouTube, to keep sending their questions. We have three questions for Rujita, and I'll pose them to you. One is from Sonal S. She's asking, certain foodstuffs are not accessible. Would you suggest vitamin supplements for the elderly along with diet, which can be accessed easily? That's number one. One is from Rekh Ratna Singh for you. What are the next steps for sharing information about proper diet and exercise with people who don't have access to resources, especially those who belong to unprivileged sections of society? And third is from Inder, also for you, my question to Rujita ma'am on how we can take care of elderly at home along with other members of the family as well. So three questions, please.
All right. Thank you very much for those questions. I think what one must remember about vitamin supplements is that there is no vitamin supplement that is effective in the absence of a disciplined lifestyle. So, what is really important is to wake up on time, sleep on time. Like ma'am was saying earlier, sleep by 10 p.m., wake up by about 6 a.m., make exercise a part of your life, at least 30 minutes of exercise every single day. And there is a whole lot of good food which is available right in our kitchens, whether it is the poha, upma, idli, dosa, paratha, dal, rice, roti, sabzi, jawar and nachni, bhakris, just eating all of these foods, reviving really our traditions of even making nutritious dry nashtas, which our grandmothers would make, just staying keeping it more commonsensical with our food is something which really helps. And as far as a nutrient supplement goes, I think if you belong to a age group or a condition where you've been recommended certain supplements, and taking them is, you know, is something that makes complete sense. But just popping vitamins for the sake of it or for a perceived benefit is something that one must avoid. So typically, I think if one is diabetic, they are asked to take B12 supplements or a vitamin D supplement. I think people who are taking those supplements, need to keep up with those. But the ones who aren't, who otherwise are doing well, should just focus on leading a good lifestyle and know that the best medicine that one can have is what one cooks in their own kitchen. So that's as far as supplements, vitamins, and stuff goes. As far as diet access for the underprivileged, I think that India is one of those countries where access to nutritious food is not expensive. In other Western countries, if you have to access good food, which is rich in nutrients, it is extremely expensive, and it's only the junk food which operates through big chains, those are inexpensive. In our country, however, millets, pulses, nuts, peanuts, chana, local berries, these are really inexpensive. These are easily accessible. So our people who are underprivileged and even people with who are affluent should both use these to their benefits. But I think for the ones who are really on a budget, something like some chana and jaggery, that is useful. Nachni or ragi ka khichdi is again inexpensive but provides you with all of the amino acids, vitamins, minerals, and fiber. That is really good. Eating a variety of dals, like moong dal or kurti ka dal, tuar dal, arhar, making them in time-tested proportions along with rice, that is something that leads to a robust diet. So just, and of course, including fresh fruits. So right now, jamun ka season hai. There are many other local berries which have names only in vernacular languages, which don't even have an Hindi synonym. So those are the berries, the local fruits that one must be eating during this time. And the third question about what can we do to not just look after the elderly, but also people of other age groups at home. I think spending more time with them, engaging with them through various activities is something that will be very, very handy. So for all of us to come together and play a game together, I think something like a hop and scotch is a little drawing that one can just make in one's bedroom or hallway and play that. One can even utilize this time to make together a scrapbook of time-tested recipes that belong to your community, that belong to your family. Put nice pictures of it and list out recipes. I think that's a good way for everyone to come together. And then maybe a few online classes where one takes up either exercise or listening to music or learning a form of classical art. I think there are various ways of coming together as a family, and we should use all of those ways during this time.
Thank you so much. There's a question for Dr. Neerja. What is the importance of or from Pratik Lodha? This is a question from Mr. Pratik Lodha for Dr. Neerja. What is the importance or role of adult vaccinations like the ones for swine flu and pneumonia for the elderly in the age group of 60 plus in these times?
Thank you for that question. So, it is generally recommended that the flu vaccine should be given every year to people, especially over the age of 60 years. And the pneumonia vaccine as well, which may not necessarily be every year, should be given, and especially to those who are prone for respiratory problems. And while these will not have any benefit for the prevention of the coronavirus, but it can possibly be helpful to have the pneumonia vaccine to prevent the super added pneumonial infection in case that person has the one as well. But it is not something which does away with any of the rest of it. So at this time in this season, I don't think anybody should be going out to take this vaccine now at this time. If you have taken it, it would possibly be of some help. But going forward, when the next season comes, and in October, typically we get the new flu vaccines, I think we should encourage all the elderly to definitely go and take the vaccines at the time.
Thank you. There's another question for you coming and says, especially for elderly females post-menopause, what specific measures should they practice to cope with depression and related symptoms? That's also for Dr. Neerja.
Yes, thank you. That's a very nice, interesting question as well. And this is a typical problem of postmenopausal women, that they do tend to get a little bit depressed many a time. And especially now with the lockdown, etc., it's both ways. Sometimes some people have family more in the house and more engaged, and they're in a happier situation. And some who are alone, stressed, fearful, are having more of the depression situation. So we do recommend that this should not be swept under the carpet. It should be attended to. In fact, family members should look out for this and see if they think that the elderly are depressed, and not sort of pepping up with engagement with the family members. And if so, then we do need to get into consultation. And again, I will emphasize, we don't want patients going out to consult. So there is a system of teleconferencing. We at AIMS have started a system of teleconferencing as well. So they can fix an appointment on those numbers, and they can seek a proper professional opinion. But there is a lot of role of the exercise as well to stimulate, and Rajita is here, she will tell better than me, but we believe that bananas have, for example, some serotonins, etc., which stimulate and make them feel better. And I think some dietary modifications maybe she can also add and suggest.
Thank you. Thank you. There's a question. Rajita, would you like to add something to this?
Well, I think that, as ma'am said, exercise is really critical. And in fact, the role of exercise is actually being looked at as therapy for depression. In fact, there's often a joke that goes around that actually exercise is just as effective as an antidepressive drug, but it never gets used because it needs full 30 minutes for feel good factor to actually come into play. So exercise is important for feeling better and for doing better, in terms of just our daily functions. So exercise is something that I would totally recommend. And along with that, I think a fresh fruit like a banana is critical. Banana, it does have mood enhancing effect. We also are in the season of mango and jackfruit, something which makes people happy, and even that is something which is quite helpful. Along with that, another nut which does lead to better moods is peanuts, because of the B6 in it, and also cashews. Cashews are something which do have a mood enhancing effect. So all these, and with this, ensuring that one is not crash dieting, because a lot of postmenopausal women um, fear that they're getting fat, and to kind of beat this obesity, they begin to have either really long gaps in their meals, or they just go on very deprived diets of just salads, or maybe just soups, or just juices and stuff. So instead of doing that, going for a more holistic way of life, going for a more wholesome diet ensures that you're not just feeling strong in your body, but also you're feeling mentally strong to overcome all of the changes that one's body and hormones is going through. So just staying basic with your food, eating local, fresh, and traditional, I think that's a good way to beat most things that ail our mind.
So you are not a believer in this new fashion of intermittent fasting?
No, sir, because with women, I have often seen that it does play a role in, it leads to many hormonal imbalances, and especially in young women, or the ones who are around any kind of a milestone like menopause, for example. It leads to major issues with their bone mineral density, also with the flow of blood around their periods. And when women are in their fertile age, if they go on with fasting for about a month or two, then actual loss of periods for a very long time. And those are not risks that are worth taking just to knock off a few kilos. So one needs to take a more sustained and holistic approach to weight loss and health.
So thank you for this very sensible advice. No intermittent fasting at all. There's a question from Inderdeep Singh for Dr. Tanuja, and his question is that my parents, my elderly people, they used to go to places of worship, parks, etc., but now they have to stay at home all the time. How do I tackle their stress, Dr. Tanuja?
Yes, sir. That's a very important question. And I'm really one fortunate person who has the opportunity to live with in-laws. My father-in-law is 87, 89 year old, and mother-in-law is 85 years. So I share the experience, what I am doing and what should be done. First important thing, what they want, they don't want anything, they want time. And if we really give them some time, and what we do, like those who are really professionals, just have dinner with them, try to listen to them. It's a emotional ventilation or something that we really give, that makes them happy. That is more important thing. They want a time of the family members. I think that everyone must do that. That is more important. Secondly, if that is not a worshipping, but Ayurveda has given more yogasanas like sitting and sleeping yogasanas, some postures like Trikonasan, Mandukasan, Tadasan, and more important is a pranayam, which includes Brahmari, Basrika, and more important is Om chanting, because that is irrespective of any religion, but that gives them mental calmness and a spiritual health also. If we really incorporate 15 minutes pranayam, we do pranayam along with our elderly in a family. If we really do these practices, I think that is the best way of keeping them busy also, and healthy and happy also. So pranayam, yogasana, some diet, healthy diet, and supplement like ashwagandha, shatavari, and yashmadhu. I think these are the key of holistic approach of making them healthy and comfortable.
Thank you so much.
Yes.
We are very fortunate to have such distinguished people with such expertise, such knowledge. We have greatly benefited from the expertise of Dr. Nirja Batla, from Dr. Tanuja Nisari, and from Rujuta Devaka, very distinguished nutritionist. And may I request you, Dr. Paul, to kindly sum it up for our viewers?
Thank you very much. Truly enjoyed the interaction. Very insightful and very with a very compassionate and caring approach that you all laid out. I'm going to what I heard are essentially 7 points. They are not in a particular order, but they're equally important. First and foremost, we will impose practice of wearing masks ourselves, but when we are coming in contact with the elderly, and making sure that our elderly wear the mask. It's a first line of defense, and we all endorse it very emphatically. Second, we heard repeatedly the notion of compassion, affection, love, physical distancing, but not emotional distancing. That has come out very strongly, and Tanuja ji, you expressed that very poignantly and very correctly in your last submission. So very important that there is no emotional distancing. There should be interaction. There should be a feeling of involvement, and yet there is a physical distancing to protect from the virus. The third element which has come out very strongly is on food, and I'm not going to repeat all the lovely things that we heard across board. Coming from Rajuta, you highlighted the mix of nutrition and the advantages of nutrition, homegrown, home-based food that you highlighted, and of course inputs from Nisari about the elements that protect the elderly, home foods which add to the immunity component. So that has come out very strongly. My fourth point is in relation to the specific immune boosting, natural, traditionally accepted Ayurveda products that you talked about. And you talked about Shatavari, you talked about Haldi, Giloy, Ashwagandha, Brahmi, Haldi, and of course I can add my favorite, which is Chyawanprash. So I think that is a very absolutely clear message. We believe it is scientific. We believe it is something which we should own up and practice, and it has the strength of our traditional wisdom, and we must promote it for all, particularly for our elderly. The next point that has come out very strongly is the notion of physical activity, and to this I would add exposure to sunlight to make the bones strong, access to openness as much as possible, stamina, and physical activity and interaction, very important. I also add 2 more points, the 6th and the 7th. One is we must be very mindful of the fact that the other comorbidities, the existing comorbidities must be controlled well. Nirja, you mentioned that, but I think it should go as a very strong message that this is the time where we must ensure even a stronger control of diabetes, even a better control of hypertension, even a better control of respiratory problem, say asthma, and full adherence to the therapeutic protocols that elderly may require if they have malignancy, for example. So there is no let up at all on caring for the existing morbidities in these times. They are even more important. So that is one point that I like to add. And lastly, which the point that was made by Nirja very correctly, that it's a flu-like illness. COVID is a flu-like illness. It is hopefully very mild in the elderly as well as it is perhaps in young people. But if you have these symptoms, do not ignore. Consult your physician. Earlier we consult, earlier we start treatment in COVID, and for that matter, any respiratory illness, better outcomes we have. So sore throat, fever is just about something that we can observe for a while. But if there is a respiratory difficulty, just rush to the care provider. Do not take these symptoms lightly in this period. And when you do that effectively and early, the outcomes are exciting, outcomes are good. Overall, then it turns out that this disease is actually a very mild disease. So what is very important is that for those who are more vulnerable than the young people, we take precautions even more energetically, and that would give them the best chance to fight and defeat the potential COVID-19 infection. So these are my 7 points, 7 sutras.
Oh, thank you
Over
so
to
much. We've greatly benefited from your expertise, Dr. Paul. Thank you so much. We'd also like to thank all our experts. We've greatly, I think our viewers have greatly benefited because we are getting lots and lots of questions, but we are running out of time. So thank you, Dr. Nirja Butler. Thank you so much for joining us. We deeply appreciate your inputs and your professional guidance to us. We thank Dr. Tanuja Nasari, the Director of All India Institute of Ayurveda, and we thank Rujuta Devaka, very, very distinguished nutritionist from Mumbai, who's joined us and whose inputs are very, very valuable to all of us. So all three experts, thank you so much. We deeply appreciate your joining us. We have greatly benefited, and our viewers have constantly benefited. Thank you so much from all your inputs and guidance to us. Thank you so much.
Thank you.
Thank you. It was a pleasure.
Thank you. Thanks. Thank you.
Thank you.